Getting chemical imbalance early has a colossal effect. By perceiving the early signs and indications, you can get your kid the assist they with expecting to learn, develop, and flourish. Eye-level perspective on little child lying on hardwood floor, pushing building squares together distinctly. What is mental imbalance? Chemical imbalance communicates through a range of side effects. Chemical imbalance range issue shows up in early stages and youth, causing delays in numerous essential zones of improvement, for example, figuring out how to talk, play, and communicate with others. The signs and indications of chemical imbalance differ broadly, as do its belongings. A few kids with mental imbalance have just gentle hindrances, while others have more impediments to survive. In any case, each kid on the chemical imbalance range has issues, in any event somewhat, in the accompanying three zones. Conveying verbally and non-verbally. Identifying with others and their general surroundings. Thinking and carrying on deftly. There are various assessments among specialists, guardians, and specialists about what makes mental imbalance and how best treat it. There is one truth, in any case, that everybody concurs on: right on time and escalated mediation makes a difference. For youngsters in danger and kids who give early indications, it can have a significant effect. Yet, regardless of your youngster's age, don't lose trust. Treatment can lessen the turmoil's belongings and help your youngster flourish throughout everyday life. One child's story. Melanie is a sound 1-year-old, however her folks are stressed over her improvement since she's not doing numerous things that her more established sibling did at her age, such as playing lookaboo and emulating articulations and signals. Melanie's mother and father attempt to connect with her with toys, tunes, and games, yet nothing they do gets her advantage, not to mention a giggle or a grin. Truth be told, she once in a while looks. What's more, in spite of the fact that her hearing has been checked and is ordinary, she doesn't jibber-jabber, make other child commotions, or react when her folks call her name. Melanie should be looked at by a kid advancement pro immediately. How guardians can recognize the admonition signs. As a parent, you're in the best situation to detect the most punctual admonition indications of chemical imbalance. You realize your kid's superior to anybody and watch practices and characteristics that a pediatrician, in a fast 15-minute visit, probably won't get the opportunity to see. Your kid's pediatrician can be a significant accomplice, however don't limit the significance of your own perceptions and experience. The key is to teach yourself so you recognize what's run-of-the-mill and so forth. Screen your youngster's turn of events. Mental imbalance includes an assortment of formative deferrals, so watching out for when, or if, your youngster is hitting the key social, enthusiastic, and subjective achievements is a powerful method to recognize the issue right off the bat. While formative deferrals don't naturally highlight chemical imbalance, they may show an increased hazard. Make a move in case you're concerned. Each kid creates at an alternate pace, so you don't have to freeze if your youngster is somewhat late to talk or walk. With regards to solid turn of events, there's a wide scope of run-of-the-mill. However, in the event that your kid isn't meeting the achievements for their age, or you presume an issue, share your interests with your youngster's primary care physician right away. Try not to pause. Try not to acknowledge a cautious methodology. Many concerned guardians are told, "Don't stress," or "Keep a watch out." Yet holding up is the most exceedingly awful thing you can do. You chance losing important time at an age where your youngster has the most obvious opportunity for development. Besides, regardless of whether the postponement is brought about by chemical imbalance or some other factor, formatively deferred kids are probably not going to just develop out of their issues. So as to create aptitudes in a zone of deferral, your youngster needs additional assistance and focused on treatment. Trust your impulses. In a perfect world, your youngster's PCP will pay attention to your interests and play out a careful assessment for mental imbalance or other formative deferrals. Be that as it may, in some cases, even good-natured specialists miss warnings or belittle issues. Tune into your gut if it's disclosing to you something isn't right, and be relentless. Timetable a subsequent meeting with the specialist, look for a subsequent feeling, or request a referral to a kid improvement authority. Relapse of any sort is a genuine chemical imbalance cautioning sign. A few kids with chemical imbalance range issue begin to create relational abilities and afterward relapse, as a rule somewhere in the range of 12 and 2 years. For instance, a youngster who was speaking with words, for example, mama or up, may quit utilizing language completely, or a kid may quit playing social games the person used to appreciate, for example, lookaboo, patty cake, or waving bye-bye. Any loss of discourse, prattling, signals, or social aptitudes ought to be paid attention to very, as relapse is a significant warning for mental imbalance. Signs and indications of chemical imbalance in children and babies. On the off chance that chemical imbalance is trapped in earliest stages, treatment can exploit the youthful mind's astounding versatility. Despite the fact that mental imbalance is difficult to analyze before 2 years, manifestations frequently surface somewhere in the range of 12 and year and a half. In the event that signs are identified by year and a half old enough, concentrated treatment may assist with revamping the mind and opposite the side effects. The most punctual indications of mental imbalance include the non-appearance of average practices, not the nearness of atypical ones, so they can be difficult to spot. At times, the most punctual manifestations of chemical imbalance are even misjudged as indications of a decent infant, since the newborn child may appear to be calm, autonomous, and undemanding. Nonetheless, you can discover cautioning signs early on the off chance that you comprehend what to search for. Some medically introverted newborn children don't react to snuggling, contact begotten, or take a gander at their moms when being taken care of. Early signs. Your infant or baby doesn't look, for example, taking a gander at you when being taken care of or grinning when being grinned at. React to their name, or to the sound of a natural voice. Follow questions outwardly or follow your signal when you call attention to things. Point or wave farewell, or utilize different signals to impart. Make commotions to stand out enough to be noticed. Start or react to nestling or contact begotten. Mirror your developments and outward appearances. Play with others or offer intrigue and pleasure. Notice or care on the off chance that you hurt yourself or experience distress. Formative warnings. The accompanying postpones warrant a prompt assessment by your kid's pediatrician. By a half year, no huge grins or other warm, cheerful articulations. By 9 months, no to and fro sharing of sounds, grins, or other outward appearances. By a year, absence of reaction to name. By a year, no jabbering or child talk. By a year, no to and fro signals, for example, pointing, appearing, coming to, or waving. By 16 months, no verbally expressed words. By 2 years, no important two-word expresses that don't include emulating or rehashing. Signs and side effects in more seasoned youngsters. As kids get more seasoned, the warnings for chemical imbalance become progressively various. There are many noticed signs and side effects, yet they commonly rotate around debilitated social abilities, discourse and language challenges, non-verbal correspondence troubles, and unyielding conduct. Indications of social troubles. Seems uninvolved or uninformed of others or what's happening around them. Doesn't have the foggiest idea how to associate with others, play, or make companions. Lean towards not to be contacted, held, or nestled. Doesn't play, imagine games, take part in bunch games, impersonate others, or utilize toys in inventive ways. Experiences difficulty getting sentiments or discussing them. Doesn't appear to hear when others converse with that person. Doesn't impart interests or accomplishments to other people, drawings, toys. Essential social communication can be hard for kids with mental imbalance range issue. Numerous children on the chemical imbalance range appear to like to live in their own reality, unapproachable and segregated from others. Indications of discourse and language troubles. Talks in an atypical manner of speaking, or with an odd beat or pitch, for example closes each sentence as though posing an inquiry. Rehashes similar words or expressions again and again, frequently without informative expectation. Reacts to an inquiry by rehashing it, instead of noting it. Utilizations language inaccurately, linguistic blunders, wrong words, or alludes to oneself as an outsider looking in. Experiences issues imparting needs or wants. Doesn't comprehend basic headings, proclamations, or questions. Takes what is said too truly, misses suggestions of cleverness, incongruity, and mockery. Youngsters with chemical imbalance range issue experience issues with discourse and language. Regularly, they begin talking late. Indications of nonverbal correspondence challenges. Stays away from eye-to-eye connection. Utilizations outward appearances that don't coordinate what the person in question is stating. Doesn't get on others' outward appearances, manner of speaking, and signals. Makes not many signals, for example, pointing. May appear to be cold or robot-like. Responds bizarrely to sights, scents, surfaces, and sounds. May be particularly touchy to noisy clamors. Can likewise be lethargic to individuals entering, leaving, just as endeavors by others to draw in the kid's consideration. Atypical stance, ungainliness, or unusual methods of moving, e.g., strolling solely stealthily. Kids with chemical imbalance range issue experience difficulty getting on unobtrusive nonverbal prompts and utilizing nonverbal communication. This makes the give and take of social collaboration exceptionally troublesome. Indications of firmness. Follows an unbending everyday practice, e.g., demands taking a particular course to class. Experiences issues adjusting to any adjustments in timetable or condition, e.g., pitches a fit if the furniture is reworked or sleep time is at an unexpected time in comparison to normal. Irregular connections to toys or weird articles, for example, keys, light switches, or elastic groups. Fanatically lines things up or orchestrates them in a specific request. Distraction with a restricted subject of intrigue, regularly including numbers or images, e.g., retaining and discussing realities about M.